The second talk in our 4-part series on the physiology of aging will focus on the cardiovascular system. At the end of this lecture, you'll be able to describe the changes to the heart and vascular system with age and discuss the impact of comorbidities and medication. You'll also be able to discuss the impact of aging on cardiovascular signs and symptoms. Our patient today is Mr. Gregory. He's a 70-year-old man who presents with abdominal pain and vomiting. His pulse is 106, his blood pressure 105/72, SpO2 94% on air. A CT of his abdomen is ordered, but while waiting for his scan, the patient deteriorates. On review, his pulse is now 134, blood pressure 90/65. A fluid bolus of 750 ml is given, but the patient then develops increased shortness of breath and crepitations to his lung bases. So you can pause the video here and try to think about why, if Mr. Gregory was in shock when he first presented, what the cardiovascular system response is like in younger and older people, and what the effect of medication might be on this response. With age, the heart has a decreased ventricular compliance, a decreased physiological reserve, and decreased adrenergic sensitivity. Because of this, as the patient goes into shock, they are less able to increase their stroke volume, and the decreased adrenergic sensitivity means that they produce less of a response anyway. Therefore, to increase heart rate, what these patients need to do, older patients do, is increase their heart rate to increase cardiac output. That's a really inefficient way of doing things and increases the risk of cardiac ischemia in situations such as shock. In addition, the response to shock is not as efficient as in the younger person. There is decreased vascular compliance and a higher vascular resistance. The consequence of this is that overall there's a 20 to 30% decrease in response to shock in the older person. Hypotension is a late and unreliable sign. The overall response to shock is inefficient, and fluid resuscitation is also less well tolerated. Patients are much higher risk of fluid overload. If we look at the response to fluid loss in the older person and the response to the fluid challenge, we can see both the dilemma with regard to diagnosing shock and also with regard to treating it. The heart has decreased contractility and compliance, and therefore as fluid is lost, the way that we try to increase our cardiac output is mostly through an increased heart rate, which is quite inefficient and can lead to ischemia. On the other hand, giving these people fluid can cause a problem because of the decreased ventricular compliance and decreased end-diastolic volume. Because of these things, the patient is much more prone to pulmonary edema and fluid overload. In response to shock, the adrenergic nervous system, the autonomic nervous system, does not respond as well because of blunted receptors and a blunted response. But similarly, in response to fluid overload, the patient cannot increase their contractility as well to deal with the extra fluid coming into the heart because of a decreased adrenergic response. Patients start off with a high peripheral vascular resistance and poor tissue perfusion, which means that they don't get hypotensive as easily, and therefore low blood pressure is a late sign of shock in older people. But also, even with relatively normal looking blood pressures, their tissue perfusion may be poor, leading to relative tissue hypoxia. When given fluid, although the blood pressure and the central blood pressure might rise, the peripheral vascular resistance may not respond as quickly, and therefore even when the blood pressure starts to go up, the patient may still not be perfusing their tissues as well as they can. In addition, fluid distribution is a problem, and therefore you may get increased risk of peripheral edema, and an increased risk of central fluid overload as well. This was a very brief overview of the cardiovascular response in the aging patient. If you have any questions or comments, you can post them on our WhatsApp group or on the TEMA website. In summary, the cardiovascular response in older people shows a blunted neurological response, decreased cardiac compliance and contractility, increased peripheral vascular resistance, and increased risk of shunting. And all these things mean that the signs and symptoms of shock are late in the older patient, and their ability to manage a fluid bolus is also decreased, leading to an increased risk of fluid overload. Our next talk will look at the central nervous system in the aging patient.